All right, so this person came in complaining of a little bit of low back pain, but then also what they call a hip pain. And they have pain that radiates down the hip and all the way down into the toes, and it happens periodically. So first thing that we do is we have the patient walk a few steps. So you want to watch how their gait pattern is initially. So go ahead and walk over there and then come on back to me. So I'm looking at the way her hips, if they're level when she's walking. The next thing I'm looking at, is she bow-legged or is she knock-kneed? Also looking, a lot of times people have issues if they're really flat-footed, their ankles deviate in, or if they have high arches and the ankles deviate out. Those are all common things. So the next thing I'm going to do, I'm going to have you stand to the side. I'm going to push along your back. You tell me if you have any tenderness anywhere, and I'm just pushing right on the lumbar spine. You start at about L1 and push all the way down. So if this causes any discomfort at all. No. And then you also want to remember, if they have no discomfort there, she's having her right-sided pain, you want to also push on the paraspinal muscles to see if they have any tenderness there. Any pain or tenderness? Okay. Nothing there. Okay. Any pain in the butt when I'm pushing on there? So you're checking that SI joint. Anything? Nope. Then the next thing you want to check is over the trochanteric bursa. People can get bursitis. That's fairly common. So you just want to find where that greater trochanter inserts and push on there. Any tenderness there? If they do have bursitis in that area, it's exquisitely painful and you really don't have to push that hard. Okay, so the next thing I'm going to do, I'm going to have you sit in the chair here actually. Go ahead and have a seat. So we're going to check the hips first of all. So we're going to start, of course, on the unaffected side. This side is affected. So go ahead and let your leg be nice and heavy, heavy, heavy in my hands. You want to externally and internally rotate that hip. Any discomfort? Nope. Okay. And then this side, heavy, heavy, heavy. Let it relax. Any discomfort? Okay. If people do have bursitis, a lot of times when you externally rotate, it irritates that bursa over there. If they have any arthritis, when you internally rotate, it's going to have a lot of pain there. If they have any chronic like impingement syndrome in the hip, they'll have a lot of pain. The next thing we're going to do is check for weakness, which is indicative of any low back issues, pinching of the discs or arthritis or any kind of acute injury. So I'm going to have you take this good leg here. You want to raise it straight up in the air and don't let me push it down. Good. And then this side. Good. She's got equal strength there. And the next thing I'm going to have you do, I'm going to put my hands on your shins and you're going to push your legs out. You're going to try to push me out. Push, 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 push. Good. Pull back. Good, 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 good. I want you to put your feet up in the air. Don't let me push your feet down. Good. And now keep the big toe up in the air. And don't let me keep your feet up. There you go. Don't let me push that big toe down. Good.